I'm big on social media. We've already posted a bunch about how I never really expected that whole thing, and to be honest, majority of my patients come from referrals from happy patients anyway, but social media is a great way to educate you guys. One of the ways I want to make sure I educate you guys is on just plastic surgery in general, how it works, revision policies, and things like that. So every surgeon has expertise in certain areas. I happen to be a revision specialist in rhinoplasty, breast, body, and now buttock. With all the buttock problems we're seeing, I'm having people from all over the world coming for all sorts of revisions. So revisions come naturally to me. Not only do I teach at UCLA and all over the world and write textbooks and scientific articles on this, it's close to my heart because for my own patients, if I have something to do, I do it, and I do it as early as I possibly can to help them out. The key though is that once I'm done in the operating room, the rest is really up to your genetic healing and if you pay attention and follow instructions. I can only be as good as the follow-ups that you keep. The follow-ups you keep coming back to see me is how we can figure out any problems. If a patient deviates from the plan, then I have no control over what's going to happen. So the most control we can have together as a team, as doctor and patient after surgery, is the patient listening. And it's very important, no matter if someone is a celebrity or they're a very busy CEO in their life, your body does not know who you are. Your body does not know that you're famous or not famous. Your body's going to heal how it wants to heal. I understand that process, and you have to work with me closely, and that's the best outcome. So some examples of proper care and treatment that's important to follow up with me, and I have patients from all over the world. As inconvenient as it is, if I need you to come in and you're busy or you're in some other country, you should go see your surgeon, and you should always go see your surgeon as often as they recommend. Keep your appointments. So that way, if there's a problem, it can be evaluated. And every ethical, honest colleague that I have, including myself, we do revisions on our own patients when necessary. Even the biggest NBA star will miss a basket. Every person with even the best genetics may not heal right. Things happen, it's the human body. But if you go to an expert, they're usually going to be experts at revising their own work too, as well as other people's work. So I always tell my patients when they come in from all over the world with a rhinoplasty or any revision, go back to your original surgeon and see what he says, follow up for that year, and go by the recommendations until you hit the max. And if it's your body, if you decide to go somewhere else, that's completely up to you. But plastic surgery is only as good as the follow-up, only as good as the doctor-patient team. The importance with follow-up and following up with your surgeon is that the surgical procedure does not stop with the surgery. The post-op protocols are very important to follow by the surgeon when he or she tells you what to do. And like I said, if I don't see the patient and I can't evaluate them and I don't know there's a problem, there's no way to solve the problem or have a solution for it. But almost every problem does have a solution. So I tell my patients to go talk to their surgeon and see what that solution is, and then they can come and compare notes with me. Sometimes temporary solutions are available. As we get to a point where if a revision is needed, you actually go and do some kind of minor surgery in the office, or if necessary, go back to the operating room. But that's the nature of surgery, plastic surgery, and medical care.